Hey, it's Dr. Ko here from Reset Ketamine in Palm Springs, and today I wanted to share with you more information about the stellate ganglion block. So first off, what is this block? Well, it's an outpatient medical procedure involving an injection of a local anesthetic and steroid near the stellate ganglion. The stellate ganglion is a collection of nerves in your neck, and the procedure is roughly 30 to 45 minutes, which aims to reduce the symptoms associated with post-traumatic stress injury, aka PTSD, by offering a reset to the sympathetic nervous system. Sometimes with trauma, this system can become overactivated, leading to a prolonged stress response and can manifest as depression, anxiety, insomnia, hypervigilance, and more. The stellate ganglion block helps by temporarily numbing this area and, in a way, having it take a nap, which interrupts that overactive state and allows the nervous system to reset. I kind of think of it as like turning off the circuit breaker for the house temporarily. And so once the sympathetic nervous system is anesthetized, it seems to come back online, and after the nap, a little bit less aroused, a little bit less hypervigilant. I hope that answers your question to what exactly is a procedure, as well as what is the stellate ganglion. You may be wondering about the history of the stellate ganglion blocks. Well, it's actually really an old medical procedure that's been performed since the 1920s. So yes, almost 100 years. It was predominantly used at that time for treatment of uncontrolled pain, for example, complex regional pain syndrome affecting the extremities. Historically, when the first SGB was done, there was no x-ray available, there was no ultrasound available at the time. So they were doing it based purely upon anatomical landmarks. Specifically, they would find the carotid artery with their hands, move it aside, insert a long needle, touching the bone, the transverse process, and then pulling back a few millimeters to inject the local anesthetic. Now, fortunately, today, of course, we do have advanced technology. And so, for example, we have an ultrasound machine in the office. And what's great about the ultrasound machine is that it can actually visualize every artery, nerve, vein to find and pinpoint exactly the target location for the medicine. So again, the SGB procedure is quite old, and there are new opportunities for this old procedure. So the studies are showing that it can be effective in post-traumatic stress injury, aka PTSD, even for some patients with long COVID symptoms and the associated symptoms of decreased smelling, taste, because it's really fascinating how we can take these old procedures and come up with new opportunities to best benefit our patients. Who shouldn't get a stellate ganglion block? You may be wondering, what are the patients who should not be getting a stellate ganglion block, and are there contraindications? Well, some of these for the SGB include a recent heart attack, where the risks due to the sympathetic nervous system manipulation may outweigh those benefits. Also, patients who are on anticoagulation therapy, or if they have a known bleeding disorder, because there is a needle going into the neck and around these really important vascular structures. Also, there are some case reports of patients with history of glaucoma, where it could exacerbate glaucoma, causing a change in the blood flow to the eyeball and pressure to the eyeball, which could potentially exacerbate glaucoma. Finally, those patients who have severe emphysema, as well as if someone already has known conduction issues with the heart and the sympathetic nervous system, because the SGB could worsen those symptoms or lead to other complications. Can patients benefit from both ketamine therapy and the stellate ganglion block? Well, you may be wondering if I can do both. And the answer to that question is yes. Both of these tools can be really powerful for healing patients as an adjunct to their existing therapy, medications, etc. Now, I would not suggest necessarily doing it on the same day because it can be pretty intense. So ideally, it would be done on separate days. But it seems to be effective and work in a synergistic way when you can do both IV ketamine therapy as well as the stellate ganglion block. And really in particular for those patients suffering from post-traumatic stress injury, aka PTSD, and or anxiety type symptoms.